Thanks for that very nice introduction. So my disclosure, not a lawyer, but I like to call myself a junior lawyer because I feel like I've learned so much about the legislative process, how to be an advocate, how to influence policymakers, how to try not to get really, really angry, and appreciate the very positive people who are on the Hill up at the legislature, who teach me how to be a better advocate and a better speaker. And so I give all of those kudos to Troy Williams with Equality Utah. He is an amazing human. And if you have an opportunity to spend time with him, please, please take it. So let's see, why didn't that advance? Do I need to use this one? Okay. All right, so from 2019 to 2024, Utah has passed some really phenomenal laws. Some address hate crime, some address name and gender marker change, conversion therapy ban, school policies, and healthcare access as they relate to transgender and gender diverse people or non-cisgender people. So among those laws that protect, we actually have a hate crime law that's pretty great, that protects individuals based on gender identity and sexual orientation. We do have a name and gender marker change law, which allows, I have this under Protect. Equality Utah says this is a space that needs work, okay? I decided to embrace the positive here and say, at least we allow people to change their name and gender marker. There are some states and countries that do not. And then we have a conversion therapy ban where we banned conversion therapy for minors. So I wanted to just kind of look into these a little bit. The hate crime law was Senate Bill 103, and it became effective on May 14th of 2019. It was proposed by Senator Dan Thatcher from West Valley City, and this is a law that specifically protects against crimes that target individuals or institutions on the basis of personal attribute. So all of those in that list are considered personal attributes, and someone cannot commit a crime against someone based on one of those personal attributes and get away with it. Okay, so we have a law that says if you do that, it's really severe and it's actually a felony. And so it specifically includes gender identity, sex, and sexual orientation. Then in this year, a sneaky thing happened. So House Bill 234 modified the vital record information without anyone noticing. And they said, you can change your name and gender marker on a birth certificate. However, you must be at least 15 years and 6 months of age to do that. So for a 12-year-old who has been identifying as the opposite gender and has been going by a name different than their birth name, it might start feeling really uncomfortable when they hit junior high and the school roster isn't going to put their preferred name and gender marker on the roll. And there's a substitute teacher who goes straight off the roll. And so they aren't going to be able to change their name and gender marker legally. So while this is sort of positive, it's still, we need some work. And the other piece is that there must be a guardian ad litem appointed for that minor child. And the cost of the guardian ad litem actually gets passed along to the parents. So we've got some work to do here. We also do amended birth certificates. So if you have to present your birth certificate, then someone will see that your sex assigned at birth was different than how you look now. But I'm choosing to embrace the positive on this one. So the other things that are necessary for modifying or changing a name and gender marker is that there needs to be a letter from a healthcare provider that provides this information that states that someone has transitioned from their sex designation of the biological sex at birth to the sex sought in the petition. They outwardly express that gender or sex for at least 6 months, and that they suffer clinically significant distress or impairment due to the current sex designation on the birth certificate. And so in our clinic, in the Adolescent Medicine Clinic, which is located at Primary Children's Hospital, we provide a letter that specifically has all of this legalese in it, and hopefully it's making the process easier for kids and families. And then the other thing I want everyone to take away from this is there are court fees, but there are fee waivers. but people have to apply for them in order to get the fee waiver, and most people don't even know that exists. So as you talk to friends, family, strangers, loved ones, whoever, please encourage them to apply for a fee waiver, because I get a lot of families telling me that it's too expensive, but they may actually qualify. A very positive bill that was passed was House Bill 228, and it made into law the prohibition of therapists from subjecting youth to conversion therapy. So in January 2020, the state adopted a policy barring conversion therapy for minors, but then in 2023, so last year, Governor Cox signed that bill that bans conversion therapy. So that's great. Then we moved to laws that restrict. And in the last 2 years, these have been horrific. They're not as terrible as other very conservative states, but they are affecting the health and well-being of the kids of Utah and in our neighboring states. So one of those laws is affects school policy regarding transgender student access to facilities and participation in sports. And then healthcare access are laws that impact transgender individuals seeking gender-affirming care. So let's look at those. So in 2022, House Bill 11 was proposed by Kira Birkeland from Morgan County. So, oh my gosh, this is my bias creeping in. I'm sorry. I really have a hard time with this particular representative, and I'm trying to find my positive space here, okay? So effective July 1st of 2022, her bill went into effect that banned transgender girls from participating in girls' sports in Utah high schools. Big surprise here. There are like less than 5 transgender girls participating in girls' sports in Utah's high schools, but she wanted to make sure all of them were not participating. And the families, the 2 families who were, decided they were going to sue the state. And in that suit, Judge Kelly created an injunction. So a month after the bill went into effect, which allows these girls to submit an application that goes to review by a state-appointed sports commission to determine if that girl can participate in a Utah High School Activities Association girl-specific sport. And then if they approve, then there's an annual review to determine if they can continue to participate. And so basically what happens at that review is that there are a bunch of people who are inadequately informed to be reviewing the information. There are like 2 people who I think are okay, and there are 6 who are probably need to be better informed, who ask questions like, now tell me why you would like to run in girls' track. Why do you want to do that? So I went home and I asked my own 11-year-old, I said, why do you want to play girls soccer? And she said, why are you asking me that, Mom? I said, I just want to know. She said, because I want to kick some butt, Mom. I was like, holy crap. If you said that to the sports commission, boom, big no, right? No, you don't get to participate. But so these girls are in a rough space when they go in front of the commission. But we still have the injunction in effect so that they can ask the commission to review their case and decide if they can participate. Right now, 1 can, 3 cannot. Okay, so then just to like really hit hard, this year, Representative Birkeland said, we need to protect girls in bathrooms and changing rooms where really bad things are happening. And she sponsored a bill called Sex-Based Designations for Privacy, Anti-Bullying, and Women's Opportunities. This sounds amazing when you read it. Like, what an awesome title, right? Sex-Based Designations for Privacy, Anti-Bullying, and Women's Opportunities. Amazing. Okay, so it got passed, and it really affects public school bathrooms, changing rooms, and locker rooms in K-12 public schools. So a transgender girl can use those spaces, but only if a healthcare provider gives them a letter to take to the school to say that they should be allowed to use the bathroom that aligns with their gender identity. Okay, so for a kid who maybe got in on I'm running out of time here, sorry, I'm really passionate about this, on the name gender marker change before this last iteration of the bill went into effect, they maybe have been flying totally under the radar. But as soon as there's this birth certificate piece that comes up, now they might be seen. And now it becomes this painful space for them. So we have work to do here. But the other space that this affects is changing facilities in government-owned buildings, typically recreation centers, so like community rec centers, or universities, so that these spaces are operated by cities and counties. The most important things to take away from this is that there is no legal consequence for transgender or non-binary people in Utah who are using restrooms. It's only changing rooms. So when a toilet is in a room that is also a locker room or a changing room where people are getting naked. And there are only penalties for people who use the bathroom for improper purposes or who engage in prurient behavior. And then it does not apply to bathrooms and changing facilities in places like restaurants, hotels, theaters, malls, blah, 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 any space that's privately owned. Okay, so we need to spread the word because there's so much confusion around this law and what's involved. And John Dougal, who is the Utah auditor, who is in charge of investigating complaints about how this bill is being enforced. Just yesterday, there were news articles about how he has already received more than 10,000 complaints, most of which are fake complaints from people like Joe Mama and Pearl McClutch. And those are some of the benign names. Okay, and he has it out for Representative Birkeland. Okay, the last thing that I have is healthcare access. This directly affects the kids who are in our clinic space. And so Utah is not alone. We are one of 22 states that have either banned or restricted gender-affirming care for transgender youth. And so this is the map of states who have banned care. It is very similar to Republican states. So healthcare is very much a political experience now when it comes to this population. So Senate Bill 16 was passed on January 28th of 2023 is when Governor Cox signed it. So that was a Saturday morning when he signed the bill and it went into effect that day. And so what that said is that anyone who has a diagnosis of gender dysphoria documented by a healthcare provider prior to that date, and who is established with the provider, not a provider, because that would mean that we can't have a team of providers. So, but who has established care with the provider for at least 6 months can receive puberty blockers or hormones as part of their gender-affirming care. Now, the next piece that went into effect was on January 1st of this year, the provider who's prescribing, as well as the mental health provider who the patient must see at least 3 times, need to have a special transgender certificate from the Utah Division of Occupational and Professional Licensing. It takes 40 hours of transgender youth specific CME to get that certificate over the course of 2 years, which is very complicated because there's not a lot of hours of transgender youth specific CME. And there are a handful of us who have that in the state of Utah now. Okay, and then in summary, this is from Equality Utah. This is their transgender protections and what they think is really great. Where transgender Utahns are treated equal. So hate crime laws, housing non-discrimination, employment non-discrimination, and protection from conversion therapy. And where there's still work to do are all of those other places. I thank you for your time. And as an optimist, growth means change, and change involves risk, stepping from the known to the unknown. And so hopefully we will step into the unknown gracefully.
Sarah.